Thank you very much, Chairperson, for your kind introduction. Good afternoon, ladies and gentlemen. My name is Jung-hwan Baek from Assam Medical Center, Seoul, Korea. Today, I'd like to talk about role of microvascular flow imaging in RF ablation of thyroid. As you know, this is a international guideline organized by Korean Society of Thyroid Radiology. Our society proposed vascular ablation technique is key technique for thyroid RF ablation. Vascular ablation technique is consists of two parts. First, feeding artery first ablation technique that can reduce heat sink effect and makes thyroid ablation easy. Second is marginal venous ablation that can reduce marginal recurrence at long-term follow-up period. This image shows feeding artery at ischemic area. Feeding artery is usually located at ischemic area, and that is why we try trans-ischemic approach method. And at the margin of thyroid nodule, there is multifocal marginal veins. At the beginning of RF ablation, we ablate this feeding artery and then ablate the thyroid nodule. At the end of RF ablation, we treat marginal veins as complete as possible. This is ultrasound image immediately after RF ablation. You can see the marginal vein, the echogenic like this, that is completely ablated by RF ablation. We called venous staining, this ultrasound finding. In China and Europe, many doctors use contrast enhancement ultrasound during RF ablation. This image shows micropapillary carcinoma. It is hypo-enhancing region at CEUS compared with the normal thyroid gland. Immediately after RF ablation, the microcarcinoma shows no enhancement during CEUS. So they proposed CEUS is an effective tool for evaluating thyroid ablated lesions. However, there is some limitations. CEUS is not approved in Korea for thyroid so far, and during RF ablation we continuously monitor the multifocal veins, but repeat injection of CEUS is not available. Therefore, our team have used power Doppler ultrasound for RF ablation of thyroid. However, in some tumors, we cannot see the vascularity inside the tumor in both color Doppler and power Doppler. So several years ago, our team started to use microvascular flow imaging. That is one of the advanced Doppler imaging tools. What about the microvascular flow imaging for this small papillary thyroid cancer. This imaging shows abundant vascularity inside the tumor because it can detect slow and small vessel signals. As we know, this advanced Doppler imaging is very useful for diagnosis of thyroid tumors. Many articles are published about diagnostic issue. In 2022, this review article summarized microvascular flow imaging provide added value over color and power Doppler imaging, and in some situations, microvascular flow imaging can replace contrast-enhanced ultrasound. So recently, our team published this article. We suggested microvascular flow imaging is better than power Doppler imaging during RF ablation of recurrent thyroid cancer. In terms of detection of intratumoral vascularity in both before and after radiofrequency ablation. Microvascular flow imaging achieved higher sensitivity and accuracy in both leader 1 and 2, intra-leader and inter-leader agreement was almost perfect and substantial in microvascular flow imaging. Let me show some representative case before thyroid radiofrequency ablation. This patient received total thyroidectomy, and we found recurrent cancer in the right lateral leg. This thyroid protocol CT shows intense enhancing recurrent tumor. What about the ultrasound? Power Doppler and microvascular flow imaging. Power Doppler shows scanty vascularity, but microvascular flow imaging shows abundant intratumoral vessels. In addition, we can see the feeding artery at the posterior aspect of the recurrent tumor. This one. At the beginning of thyroid RF ablation, we directly puncture this area. You can see, like this, and then ablate the feeding artery. Immediately after feeding artery ablation, feeding artery showed no more vascularity on microvascular flow imaging, and the intratumoral vascularity is nearly disappeared. It is very similar to TACE achieved by radiofrequency ablation. At the end of RF ablation, there was no vascularity inside the recurrent tumor on microvascular flow imaging. Another patient received total thyroidectomy, and during post-OP surveillance ultrasound, we found some hypoechoic lesion at right surgical bed. I was confused. There was no vascularity on power Doppler imaging. Is it recurrence or post-OP fibrosis? When you applied microvascular flow imaging, the lesion showed intense vascularity like this, it is compatible with recurrence rather than post-op fibrosis. So biopsy confirmed recurrence and then performed RF ablation. Before ablation, we used a large amount of hydrodissection around the tumor, and then we can safely ablate the recurrent tumor. Another case shows this patient showed increased serum PTH and calcium level that suggests this patient has parathyroid tumor. Grayscale ultrasound found small hypoechoic region inferior to right thyroid gland. However, color and power Doppler imaging shows no vascularity inside the tumor. How about microvascular flow imaging? Shows intense intraregional vascularity and the feeding artery here. So biopsy confirmed this is a parathyroid region, and we successfully treat the parathyroid adenoma by radiofrequency ablation. This patient visited my outpatient clinic because of bulging and pain at the neck. We can see the solid and cystic region in the left thyroid gland. In the solid intracystic portion, we cannot see the vascularity on microvascular imaging. That suggests this lesion can be successfully treated by ethanol only, rather than expensive RF ablation. So we performed ethanol ablation for this patient successfully. Let me show the value of microvascular imaging after thyroid radiofrequency ablation. Here is the vascular solid tumor. Was first managed by RF ablation at 2008. 1 month after ablation, there is some marginal vascularity, but 3 months, the nodule grows very fastly. We must ablate the feeding artery surrounding venous structures as complete as possible. So additional RF ablation was performed for this patient, including marginal vessels completely. And 8 months after RF ablation, you can see the completely collapsed left thyroid nodule. As I introduced, vascular monitoring after radiofrequency ablation is mandatory. In this benign thyroid nodule, about 5 centimeters, we performed the first RF ablation, and this 6 months ultrasound feature shows small amount of marginal vascularity on power Doppler. However, vascularity is prominent on microvascular flow imaging. This transverse image shows similar vascular feature. Microvascular flow imaging shows vascularity on solid component and draining veins clearly like this. In second ablation, we target the marginal veins as complete as possible, like this. You can see the echogenic venous staining is very nice on this ultrasound imaging. And the microvascular flow imaging shows normal vascularity in and around the thyroid nodule. At 17 months after RF ablation, you can see the completely ablated benign thyroid nodule like this. Finally, let me introduce some softwares for better use of microvascular flow imaging. Tissue suppression, filter, and vascular index for quantitative assessment of vascularity. Tissue suppression. The function of tissue suppression suggests this function reduces strong signals, that means hyperechoic signals from soft tissue. This solid and cystic lesion was managed by ethanol ablation. Immediately after ethanol ablation, there is remained solid component. So we performed microvascular flow imaging, shows some linear internal vascular signals. But when you apply the tissue suppression, that can suppress the vascular signals from echogenic regions. We sometimes call the twinkling artifact. It was completely removed after tissue suppression. And the filter can suppress the artifact produced by movement. We sometimes call the pulsation artifact. This moving tissue artifact is prominent when you detect a lower flow blood signal. Here is a recurrent tumor. When you applied microvascular flow imaging, multifocal pulsation artifact from the surrounding arteries like this and like this. When you apply the filter function, you can see the suppressed artifact from the arteries. Similar cases of pulsation artifact was suppressed by filter application. And finally, let me show vascular index. Here is some vascularity, and the area of this ROI is presented as 0.06, and the vascular area, vessel signals, are presented as 0.03. So vascular index is measured as 47% in this image. So we can measure the vascularity of this papillary cancer. Microvascular flow signal shows vascularity along the vessel, along the tumor, and the vascular index was 51% in this case. So today I introduced our recent publications comparing microvascular flow and power Doppler. Microvascular flow imaging shows better results in recurrent thyroid cancers in terms of detection of tumor vascularity and achieved higher sensitivity and accuracy. Microvascular flow imaging is also useful for the diagnosis of thyroid and parathyroid regions, and it is mandatory for monitoring of tumor vessels during thyroid RF ablation. Thank you very much for your attention.